Welcome to Solutions OP Clinical Trials Podcast. My name is Olga and I'm the Managing Director of Solutions OP. We are a small team of experienced professionals working on clinical trials in the United Kingdom. I'll use our podcast to discuss hot topics in clinical trials and provide analysis of the latest trends and challenges in pharma and medical device industries, not just in the UK but globally. Thank you for listening. Welcome to the latest episode of the podcast. In today's episode, I will discuss if all men need prostate cancer screening. That's been a bit of a hot topic at the moment. And as someone who has worked in HIV research, I fully understand the need of early diagnostic and its importance. But sadly, diagnostic has never been as a priority area in drug development. And our focus has always been in treating consequences rather than identifying the disease early. So I understand the importance of early diagnostics and screening. However, in the UK at the moment, I think it's turning into a little bit of a political issue where some politicians are pushing to have more men going through a prostate cancer screening program, while the medical bodies are saying that that's not really a great idea. So I want to discuss what is the current situation and exactly why the medical bodies don't want really to roll this to basically everyone, and really to examine the facts about prostate cancer screening at the moment, what kind of methods we have, how reliable they are, and all this. So as I said, there's a growing push in the UK, but that's not only in the UK. There are other countries too who are interested in rolling out prostate cancer screening for more men. Now, according to the statistics of the World Cancer Research Fund, the prostate cancer is considered the fourth most common type of cancer, and it's the second most common cancer in men. The statistics from 2022 shows that 1.5 million cases of prostate cancer were detected during that year globally, and the majority of these cases were in the US, China, and Japan. While UK is behind in prevalence, considering the population size, it's still quite high, with over 55,000 cases in 2022. So no doubt prostate cancer is a serious issue, and there are concerns, of course. We need to have a proper screening program. The current guidelines across the Western countries recommend risk-based approach. That means that not everyone goes through prostate cancer screening, but it's targeted for specific groups. For example, it's recommended for men age of 50 and older, those men who have close relative who's been diagnosed with prostate cancer, like brother or father, and also men of black ethnic origin. So interestingly, it's been identified that that ethnic background double the risk of prostate cancer. And then I will just briefly to you present the different methods for prostate cancer screening that we have at the moment, and what is basically the process once we have some suspicion of prostate cancer. How do we diagnose it? So the first method that is used is the PCA blood test, which is the first method we use in diagnosing prostate cancer. It's a blood test that measures the amount of prostate-specific antigen, which normally circulates in the body. So PCA is a protein which is produced by both normal cells but also cancer cells. And with the age, when the prostate gets bigger, the levels of PCA increase. So that means
higher PSA doesn't necessarily mean that the patient has a prostate cancer, because there are various reasons that could cause the elevation of PSA. And some of these reasons are, for example, urine infection, or vigorous exercise, or ejaculation, anal sex, or prostate stimulation. Also, some medications could cause to elevation of PSA. Some surgeries like bladder or prostate surgery, urine catheters could also increase PSA, and even prostate biopsy. So, for example, if someone had a prostate biopsy within 6 weeks and they have a PCI test, their PSA levels will be higher. So, as you can see, PSA by itself is not a reliable method that we can use to diagnose prostate cancer. In fact, the statistics shows that the tests tend to have 75% false positive results. So that means that the test shows potential prostate cancer, while in fact the person does not have a prostate cancer. So their PSA level are elevated due to various other reasons, so not necessarily due to cancer. And another worrying statistics is that 15% of the test results are false negative, which means the man has a prostate cancer, but the test is just not diagnosing it correctly at that stage. So I think it clearly shows that PSA by itself is not 100%. So the next step in diagnosing prostate cancer after someone has a positive PSA test is the digital rectal examination, which involves the physician using gloves and lubricant to put a finger into the rectum and try to identify if there is a cancer mass. While this will not diagnose the cancer itself, it will allow the physician to physically feel the prostate gland for abnormalities. So this is another important way to avoid any further, even more invasive methods of diagnostic. So after this examination, if there's still concerns about prostate cancer, then the person will have an MRI scan, and depends on what it's an imaging method. Obviously, depends on the imaging. If there's further, suspicion for prostate cancer, then the next step is biopsy. Biopsy is probably the most accurate method so far in identifying prostate cancer, and still it misses 1 in 5 cases. I think it's very important to point this. There are 2 types of biopsy. The first one is transperineal biopsy, which is done with local anesthesia and involves inserting a needle through the skin behind the scrotum. And the second method is transrectal biopsy, which is done with full anesthesia and involves inserting a needle through the rectum. So some of the common side effects are pain and erectile dysfunction. So while the general view is that the erectile dysfunction problem will resolve within the next couple of months, there are some reports that claim that there have been cases where this doesn't resolve. So would that be a result directly of the biopsy or not? We cannot tell for certain, but we have to consider the psychological effect as well of for a man who is undergoing that kind of testing and all the scare and worry that he's going through. So this inevitably will have also effect on their sexual health. So I think these methods that we use in prostate cancer screening could tell you and show you that while they can help in identifying prostate cancer, they're not 100% reliable. And not just that, but many of them are not even, highly reliable, if I can put it that way. And that's the reason why many physicians are pushing back on the current initiative to screen more and more men for prostate cancer. Firstly, because they are familiar that these are very invasive methods and they're not reliable, and second, because putting men through all these procedures when they don't have a prostate cancer could be a lot of stress for the person. It could have a negative long-term effect on their sexual health. And another reason, obviously, is that this will increase the workload for the hospitals. If you have to screen people that there's nothing wrong with them, but because you suspect something, this will increase the workload, and potentially it will actually have a negative impact on those who have prostate cancer, because they'll have to wait longer to get to the screening program. So as I explained so far, I think it's a very complicated case, and maybe it's not the best idea to roll on the prostate cancer screening program as it is to more men. And what we need to do instead is something different. There is interesting research in prostate cancer diagnostic. In a paper which was published in 2020, there is a method which was described using flow cytometric profiling of blood immune cells. And this method shows 99% accuracy of diagnosing prostate cancer. Now, this is a method which is still in development. Of course, it's not available on the market. But if that method confirms to be reliable, it will be a fantastic new opportunity to actually roll prostate cancer screening to more men and identify it earlier. If we keep that 99% accuracy, if that's confirmed, that will be a fantastic thing. It will not be invasive, and it will be worth investing in that kind of research and developing new methods and new diagnostic tests which will actually provide reliable information. So my conclusion is that the existing methods that we have do not provide reliable information to diagnose prostate cancer. They are very invasive. They could affect the long-term health of men, and they will inevitably increase the burden for the hospitals, and they will delay the diagnosis of new cases. So that's my view on the existing prostate cancer screening tests. But as I said, this new method that I've read about, it sounds very promising, and if it's developed and it proves to be efficient, it will be a fantastic way to actually roll a proper prostate cancer screening for men. It's all about risk and benefit, and if we see that the risk is a lot higher than the benefit, I think we need to think again before we subject all men to unnecessary screening program. Thank you for listening.